it so that people could skip the lobby, but that seems not to be working for us. So sorry about that. All right, just give us one more minute and we will start. Okay, can I just get a thumbs up from somebody that they can, oh, no, I haven't shared it yet. All right, can I get a thumbs up that people can see this PowerPoint?
I don't see anything on my side.
Oh,
Laura.
still working. Yep, it should be up. You see it now?
There you go.
Okay.
Yep.
All right. Tanya, take it away.
All right. Good afternoon, everyone. My name is Tanya Brown. I'm the Executive Director for US Vets White and I, and also the Continuum of Care Chair. I get the honor of sharing this report alongside Laura Thielen, Executive Director at Partners in Care, and Anna Pruitt, who is the Director at University of Hawaii at Manoa, the Office of Poverty Research and Action. So on behalf of us, we just want to thank all of you for taking the time to join us as we share our findings from Oahu's annual point in time count. So I also want to just stress, right, and remind everyone that today is really also more about the numbers, right? It's much more than just the numbers. It's about people. We're talking about families, veterans, kupuna, individuals in our community who are experiencing homelessness, and the collective responsibility that we all share, right, in responding with urgency, compassion, and solutions. So we also want to acknowledge the many service providers and outreach workers, volunteers, government partners, and individuals with lived experience who helped us make this year's count possible. And then, of course, our data team at Partners in Care for working on gathering that data and making it ready for us today. So let's jump right on in. The point in time count, often referred as the PIT count, is a federally required annual count of individuals and families experiencing homelessness on a single night across our community. The count includes individuals who are unsheltered, meaning they are living outdoors in vehicles or, places that are not meant for human habitation, as well as those staying in emergency shelter or transitional housing programs. So the point in time count, the purpose is to provide a snapshot of homelessness in our community. It really helps us to better understand the scope of the need, identify trends, trends over time, and then ensure that resources, funding, and services are informed by real data, right? So most importantly, the PIT count helps communities, decision makers better understand who is being impacted and where we need to strengthen our responses. Now, the PIT count is important. Oh. Sorry.
Sorry, go.
So the PIT count is important because data drives decisions, right? The information gathered through this process really helps to inform, like I said, federal, state, county, and local planning efforts, related to housing, homelessness response systems, healthcare, outreach, prevention, or and supportive services. It really allows us to be able to measure progress over time, and to understand where we are improving, where we're seeing challenges, where the challenges remain, and where the gaps are, right? So beyond funding and planning, the PIC count creates visibility as well. So it ensures that individuals experiencing homelessness are seen, acknowledged, and included in the broader conversation about our community's well-being. So while the PIC count is only a snapshot of one point in time, it remains one of the most important tools we have for understanding homelessness across Oahu. Next slide. So this year's point in time count on Oahu took place on Monday, January 26th, with teams deployed across the island during the early mornings from 6 a.m., as you can see, till 10 p.m., so all throughout the day and evening. We had hundreds of volunteers, outreach teams, providers, and community partners that came together to canvass the communities. They also took count of shelters, encampments, and other known locations where folks are experiencing homelessness and where they might be staying. This effort really does reflect a tremendous amount of coordination and participation across sectors. And so huge shout out to IHS and Kealoha West Oahu and all of those who helped lead this effort. I also want to share that leading up to the count, we had a lot of trainings so that folks you have tools in place to be able to make sure that the count was as accurate as possible. Okay, so this year's point in time count provides us with the updated snapshot, like I had mentioned, of homelessness on Oahu, and it highlights both ongoing challenges and areas where progress continues to be made. While every data point represents a person and a story, the overall findings help us better understand the trends. Today's results really enforces the importance of continued collaboration and housing investment.
Thank you, by the way. Huh? Thank you. What? For this. Oh, yeah.
Thank you. It really enforces the importance of continued collaboration, housing investment, prevention strategies, outreach, and supports. As you can see here, there are drastic challenges and areas in unsheltered count and the sheltered count. There are drastic changes there. However, overall, those experiencing homelessness, the count itself has relatively remained the same with a 1% increase. So I know that Laura and Anna are going to dive in a little bit more deeper into the trends that we're seeing. And so at this time, I would like to hand it over to Anna.
All right, thanks, Tanya. And thanks for those reminders. Can you hear me okay?
Yep.
Okay, great. Sorry, I was having trouble with my mic earlier. Yeah, so I think, some really interesting trends to point out this year. One of the things to note is that even though we saw just a tiny increase in the number of overall folks, we see pretty big changes within the unsheltered and the sheltered count. So you can see the unsheltered count dropped by about 20%, whereas the sheltered count rose by about 35%. So what we're seeing is that more people are being sheltered than unsheltered. So if you go to the next slide. Okay, yeah. So yeah, for the first time since 2018, I think, we're seeing more people sheltered than unsheltered. So that's a pretty significant finding. Here is a breakdown of the different regions. Now, I do want to note that this year we have slightly different regions than we have in the past. They changed in, I think, June of 2025. But here you can see kind of the distribution of the unsheltered population. So you can see a larger concentration in Region 8, which is the Waianae Coast, with about 31% of the entire unsheltered population. The next highest is kind of the downtown Chinatown area, Region 1, with about 17% individuals experiencing unsheltered, or 17% of the unsheltered homelessness are concentrated in that area. The rest are a little more evenly distributed. You can see here Region 6, which is Waikiki area, has the smallest percentage of the overall unsheltered population from this year's PIT count. Next slide. Yeah, so like I said, the regions changed in 2025. So this is just kind of a map of 2024. The region numbers are different, and you can see a slight difference around the Waikiki area. In the new map, Waikiki is carved out, whereas in the old map, it was kind of split between Region 2 and Region 1. But you can kind of get a sense of how the numbers may have changed, right? So a little larger percentage of the unsheltered population on the Waianae Coast, but that could be partly because it's now kind of includes part of EVA. So it's not a one-to-one comparison. So it's really hard to make any sort of statement about how people have moved around compared to 2024. But hopefully this can give you a little bit of an idea. I don't know, Laura, did you have anything to add on this one?
Yeah, I would just add that part of the reason that the regions have changed is because there's several different maps that we could have copied over, but the State Homeless Programs Office, made the decision at the beginning of their contract year in June 2025, and these align more closely with the police districts. So you'll see a combination of the term district as well as region, and they are somewhat the same. And so one of the things that we'll be looking at going forward is we're lucky enough that the tool that we use, which is Survey 123, allows us to geolocate where surveys and observations were made. And we've got that information from the last several years. And so if we wanted to go street by street and actually match these up to the old regions, we could do that. We can't do it for every street or anything like that, but for being able to compare some of those things, we can look at that. But looks like this is the way that the districts and regions will be going ahead from here on out.
Okay, thanks, Laura. Go back one more thing I wanted to point out.
Sure.
So I think one of the only other kind of trends I noticed from 2024 to 2026 here is kind of the increase in what used to be Region 5 that is now Region 2. So up from 130 individuals to 27, and from 5% of the unsheltered population to 10%. So I think that'll be important when we talk about things like where our shelters are located, right? Okay, so now you can go.
Okay, so this is, oh, go ahead.
Oh, sorry, go ahead. No. Go ahead.
No, I was just going to bring up that we are very lucky. We've got information going back several years that we're able to bring to you folks. And so it's really important. We generally do the count every year. We did take a year off in 2021 due to COVID. And then our entire COC made the decision last year that we were not going to be doing the 2025 count. HUD requires us to do a count at least every other year, and they mandate that it be done on the same year, so 26. So it's always on an even number. But I think going forward, hopefully, based on what the COC would like to do, we would like to see these done annually, because if it can give us some information that we might miss out on, such as if there's a natural disaster or something along those lines, it's important to be able to have these numbers looked at on an annual basis. Go ahead, Anna.
Okay. Yeah, so here, Tanya's talking about how important it is, the PIT is to looking at trends over time. So here, let's look all the way back to 2010. You can see that there was like a steady rise in the total PIT population, largely driven by the rise in the unsheltered population from 2010 to around 2016, 17. And then it starts to drop. It's through 2023 before rising a little bit in 2024. And now, thankfully, it has kind of leveled out. But one of the key things that you can see here are the changes in the numbers of the unsheltered and sheltered population. So since 2019, we've had more unsheltered than sheltered. So for the first time this year, that has flipped, and we have more people sheltered than unsheltered, suggesting that we're moving people from the streets into shelters. Anything else you want to put out on this one, Laura, before we move on?
Nope, I think we're good.
Okay. So I think we've already covered this.
Yeah, we've
so we
already
can probably
covered
keep
this.
going.
Yep. And then this is our heat density map. And this is a really cool thing, but also very important. It allows us to see where most people were encountered within each of the regions. And so as the light gets bright, the bigger population of folks that are being interviewed or observed in that region. So it gives a real clear outline of where some of the kind of deserts are in regards to people not being in those areas, or we are not able to capture the information from those areas. There's always room for improvement. And like we've said before, it's a snapshot. We definitely don't have every single person counted, but this, along with other information that's available in our inflow and outflow dashboards, give us the other side of the picture, or an additional side to our information.
Okay, so now let's dive in a little bit more and look at what kind of the demographics are of the PIT population this year. So as in previous years, we see a higher percentage of men than women and other genders. So a little more than half of the total population identified as a man or a boy if they were a child. So this is a slight increase from last year, but nothing significant. Okay, next slide. So what is interesting is when you look at the differences between the demographics of the sheltered and the unsheltered, and what kind of stands out here is that the sheltered population has a higher percentage of women and girls compared to the unsheltered population, and a smaller percentage of men and boys than the unsheltered population. So what we're seeing is women and girls are more likely to be sheltered, men are more likely to be unsheltered. And if we look at the race, this is very similar to previous years. We see that Native Hawaiian or Pacific Islander groups are comprise about 43% when we're thinking about race alone. So this is not multiracial. Native Hawaiian Pacific Islanders, about 43% of the overall population, followed by multiple races at 24%, white at 16%, Asian or Asian American at 11%, 5% Black African American or African, and then 1% American Indian. If we compare this to the overall population on Oahu, what we can see now are some disparities, right? And so we've talked about this in previous years, but the fact that these disparities remain, is something to consider when we're thinking about programming and approaches. So what you can see here is that Native Hawaiian or Pacific Islanders are overrepresented, making up 43% of the homeless population compared to 10% of the general population on Oahu. We see the opposite kind of trend for Asian or Asian Americans, where Asian or Asian Americans make up about 11% of the homeless population, but 43% of the Oahu population. We also see slight disparities with individuals who identify as white as being slightly underrepresented in the point in time count or the homeless population, and Black and African American or African individuals being slightly overrepresented. But you can really see the disparities clearly with the Native Hawaiian and Asian groups. And then if we look at this by sheltered and unsheltered, they show very similar trends, but we can see a little bit of differences. Particularly, you can see that Native Hawaiian or Pacific Islanders and people who are multiracial, they are slightly overrepresented in the sheltered population compared to the unsheltered. So, for example, if you look at multiracial individuals, they make up 28% of the sheltered population and 18% of the unsheltered population. We see the opposite kind of trend with individuals who identify as white, making up only 13% of the sheltered, but 20% of the unsheltered. And similarly with the Asian American groups, making up 9% of the sheltered compared to 14% of the unsheltered. So what we're seeing here is that Native Hawaiian, Pacific Islanders, and multiracial groups more likely to be sheltered, white and Asian American more likely to be unsheltered. So these are things to kind of consider as we continue to approach homelessness. Next slide. Okay, so here are some characteristics of our unsheltered population. So what happens during the point in time count, during the unsheltered count, is folks are offered or asked to participate in a survey, and some decline and some say yes. They are counted either way in the point in time count numbers. But for people who do complete the survey, we're able to get a little more information about what their experiences are like. So these numbers are based on those folks who agreed to participate in the survey. So the vast majority, over 3/4, have been homeless for 1 year or longer, meaning so they've been on the streets for a long time. And about 33% had one or more pets. And we know that pets can be a barrier to housing. So that's one of the reasons why we ask about that. So that can help us know how many, of our unsheltered population tend to have a pet, so that we can try to make sure we have programs that can meet those needs and have the capacity to meet those needs. About 20% were homeless before age 18. We know that childhood homelessness is associated with lots of, can someone mute themselves, please?
It's about the point in time count. They're going over the.
Thank you. So we know that childhood homelessness can be associated with lots of different kind of mental health and physical health outcomes. And so knowing that can help us kind of know what to expect when it comes to treating and serving those folks. A couple other things, about 8% of adults and unaccompanied minors were employed full-time or part-time. And about 48% of them said that they had been recently impacted by sweeps. If we look here at this chart, that's a little blurry, apologies. These are the primary causes of homelessness for these folks. So you can see 63% identified economic hardships like getting, losing a job, which makes sense because we see low rates of employment, right? So losing a job, not being able to find another job, losing their disability benefits, things like that. And then 48%, so almost half, had some sort of contributing health factor. So this could be a physical disability, a substance use issue, mental health issue, a chronic health condition. And then one other thing that I wanted to point out is that 32%, so a good chunk of folks, identified some sort of family crisis. So either breakup of the family unit, either through divorce or death or an argument. And this is higher than what we see in other populations. So it suggests there's something maybe unique about Hawaii in this way. And then the other two causes, about 9% was just loss of housing through eviction or something like that, and other. So that other category, folks can choose more than one cause. And so a lot of times they choose multiple causes, and other is one of them. So that's why it's such a high percentage. So hopefully this can help us tailor programs that target this population by knowing kind of their characteristics and what their needs are.
And I'll just add on to this that because we didn't mention it before, if a person fills out a survey, it is a question, a surveyor actually asks the questions and they get trained on how to ask the questions to make sure that it's equal to any other surveyor asking questions across Oahu. And this is self-reported information. So I just want to make that clear that while these are the true answers from people themselves, we don't ask for proof of anything, like if they have a dog or a cat or anything like that. But it is all self-reported, and we are required to use the survey in such a way that the self-made answers are what we rely on.
Is this me?
Yep.
Okay. Okay, so that was the unsheltered population. So if we take a look at the sheltered population, we can see a notable increase in kind of sheltered capacity or shelter enrollment at the point in time count since 2022, right? We've seen a steady increase with a sharp increase since 2024 from 1728 to 2331 this year. And that's been primarily driven by an increase of enrollments in emergency shelter. So that kind of makes sense when you look at the numbers, the unsheltered numbers, right? The decrease in the unsheltered and the increase in emergency shelter. So that could be part of the story there, but we don't know for sure. So if you look at transitional housing, we can see it's trended down since 2018, and that is in part due to kind of funding priority changes at the federal level. But I think we're starting to see an increase in those programs as well. And this is the total bed capacity over time compared to the number of people who were enrolled in a shelter program on the day of the count. So you can see just under capacity, particularly in the last couple of years. I don't know, is there anything else you wanted to point out about this, Laura?
Yeah, I would just say that the HIC, the housing inventory count, we are required to submit that every year, and that's why we have information on that throughout every single year since 2017. But there is also, there may also be other shelters or programs that are not known to us. We hope that we have every shelter in here, but that may not be the case, especially if it's like a church organized or a congregation organized shelter. So we do encourage anyone who's providing any types of services to those experiencing houselessness and homelessness to become part of our coalition so that we can actually pull in as much information as possible. And like Anna has been saying, while we cannot completely understand why the changes are what they are in this report, I think one of the things that I wanted to share is that based on the new Kauhale initiative, where there's many new beds provided through that initiative, that has been wonderful. That has added to our overall bed count on Oahu. And we are listing them currently as emergency shelter. And there's a specific reason for that. And so I wanted to share that with you because when the model of a Kauhale came up, the hope is that people would be able to use that as possibly their permanent housing going forward. But one of the things that affects is that if somebody goes into a Kauhale and it is considered permanent shelter, they will lose their chronicity of homelessness. And for those who are not in this service industry, that might sound a little bit strange, but the chronicity is what we rely on to see as one of the points of getting somebody into housing faster than someone else. That their vulnerability is probably higher than with someone who has just entered homelessness. It's not a fair system. There's no way of, exactly figuring out who should be next with getting any of the very rare vouchers that we have. But we want to make sure that folks who are going into the Kauhales, that they understand that that is the effect that may happen if they are considered permanent housing. So for right now, we are looking at all of those Kauhales as temporary emergency shelter. But that may change over the years if the Kauhales choose to do that. But just wanted to clarify that because Kauhales is not like a carve out within this report, but we will be working on those types of numbers and information so that we can share that at a later time.
And they are included in this number
Yes.
here, right? Yeah.
Yes.
So they are included in the 3016. Yeah.
Yeah.
Did you want me to cover this one?
No, I'll do this
Okay.
one. We were debating whether to put this in here or not because but I think it's a really important thing for us to see. Along with that chronicity comes the length of stay that people are having in the emergency or transitional shelters. Our hope is that homelessness will be short and rare and non-duplicating over the years, and definitely not multi-generational. So our goal is to try and decrease the amount of time that people are spending in the emergency shelters and transitional shelters where they can go into permanent housing. But this reflects really a big part of this is that there are not a lot of vouchers for folks who have disabilities that are not able to work. So this is kind of telling the story that we would like to see these numbers decrease significantly, but due to the lack of affordable housing and programs and vouchers, that right now, this is the reality of what we're looking at.
Okay, now it's me again. So we also thought it would be helpful to see, on any given day, on Oahu, there are people enrolled in permanent housing programs. So they are not considered part of the point in time count because they are housed, so they are no longer homeless. But permanent housing programs are housing programs for formerly homeless individuals, right? And so we wanted to give you just a snapshot and even looking at the trends over time of the number of people who are in permanent housing on the day of the PIT count over time. So you can see an increase in the total number of people who are enrolled in permanent supportive housing. So that's when people have a voucher plus some sort of wraparound services. So it's the most intensive type of program. As you can see, the number of people enrolled in that increase as that top green line from 2017 all the way up till 2024, where it dropped pretty sharply in 2025, but thankfully starting to tick back up in 2026. So hopefully next year, when you see that previous slide, right, you'll see those numbers reduce because we'll be getting people into housing more quickly. The kind of middle gray line is rapid rehousing. And so one thing to point out there is that, so rapid rehousing is usually shorter term rental assistance for homeless folks. So permanent supportive housing, it usually doesn't have a definite end date, right? Whereas rapid rehousing, depending on what type it is, might be limited to 6 months or a year. But you can see that the number of enrollments dropped from 2022 to 2023 and have kind of remained lower than we'd like. So, you know, we'd like to have a little higher enrollments in rapid rehousing. And then the other permanent housing, which is the bottom green line, those are things like emergency vouchers. We got an influx of those during COVID, so that's why you see that kind of tick up there. But this is an important part of the overall system because this is kind of the end destination, right, for folks. So I don't know, does anything else you want to point out, Laura?
No.
Before we go to the next slide?
No.
Okay.
Okay, so coming up on the next 8 slides is the individual regions that we are counting in. And like we said earlier, because the change of the regions, we're not able to do a straight one-to-one comparison from 2024 to 2026. But you can see on the map here, the little red area is region 1, and so that's our downtown area. And folks, for the most part, we're stating that inability to pay rent and substance use was the main factor in them becoming homeless or houseless. This is the North Shore area, Wahiawa, and Central Oahu. This is one of the smaller counts in the point in time count. It is a very large area, but there are not a ton of services out in that area, although we are seeing a few shelters opening up and some permanent housing. So we hope to see some successes in this area to get this number down a little bit lower. For this area, again, you'll see across the board that substance use and inability to pay rent are the factors that people are reporting themselves, that those are the reasons that they are being unsheltered at that time. Okay, so this is the whole Windward area. Again, there is a lack of services in the upper Windward area. We are starting to see some more outreach in that area. This is IHS's area to do outreach. Although there are not really any shelters out in these areas, there are some in the lower Windward area, including in Waimanalo. And here you see a little bit of a different reason as one of the top reasons for becoming houseless and homeless is household arguments, as well as the inability to pay rent. We have found across the board that finding rental units that are affordable on anywhere on the Windward side is extremely difficult. And a lot of the folks that are experiencing unsheltered homelessness on the Windward side are from those areas. And so they have possibly some supports in that area, which may be adding to their wanting to stay on the Windward side versus going to one of the other shelters on the other sides of the islands. All right, and this one, again, we're looking at one of the smaller numbers, which is great. We would like to continue to see this area going down. We noticed that there was a somewhat large group of veterans in this area, and a lot of the reasons for that may include that their proximity to services. And for region 6, this is a carve out. This used to be part of a larger region. So this is a very low number. We had a lot more observations in this area versus surveyed. We would like to get as many surveys completed as possible. So this will be one area that we look at next year to make sure that we can get more people surveyed so that we can get all of their information. One of the things that came out that I've seen some stuff on social media and in the papers, we did see that the Waikiki Business Improvement District has conducted their own point in time count, and they do that frequently. It's a really great program run by the Waikiki Business Improvement District. That is separate from this count. But one of the things that we were able to observe is that while there was a decrease in folks in the Waikiki central area, There was not a significant change throughout a larger area of that portion of the island. So we'll be hopefully working with Waikiki bid folks to look at their results and our results and see what we can do to make sure that it's not just moving folks, but we're actually getting them into services and housing. So thank you to them for constantly doing those point in time counts, because it does really help us really connect with folks. Again, this is IHS's area for outreach, and they have a long history of providing services in that area, which is wonderful. Sorry, I wasn't sharing my film. Okay, and then we go on to Region 7. And this is the Hawaii Kai area, wrap around a little bit. So again, we're not seeing the carve out from the Waikiki and the Awana area, but it is significant to note that in the primary causes for those folks who were observed, or actually only the ones that were surveyed, that their primary cause for homelessness and houselessness is job loss and an inability to pay rent. And then Region 8, which is one of the largest areas that have the largest population of folks experiencing homelessness. This has been an ongoing trend, and this is also where a significant number of individuals who are Hawaiian, Native Hawaiian, are residing. And we've got Kealoha West Oahu is in charge of this region district. And they know their folks very well, and they have a long history in this area as well. We're seeing more services coming up in this area. So hopefully we will be able to see some significant changes over the years upcoming because there is so much attention being placed on this, including the wrapping in of Department of Hawaiian Homelands into programs. They've just opened a program out at the Barbers Point area that US Vets is working with, as well as KWO. So hopefully we will see a substantial change in this once those programs are up and running and taking in new folks. And then we really just, this has been a special population that we have watched through the years. And I'm very proud of all the folks that work with veterans within our community. We have seen a significant drop in veteran homelessness over the last several years. And I want to believe that that is due largely in part by those veteran-focused programs to really drill down on the reasons folks are experiencing homelessness in the veteran population, which tends to be single males, and making sure that we are looking at programs specifically for that population. So that they can get the services they need. And some of that may also include assisting them to get back to a home base that may be on the continent or somewhere else, because we notice that veterans are a very transient group. And so if they are not from here, the possibility of actually assisting them in moving back to the mainland or somewhere else is a high priority. And there are a couple of programs focused on that. And then below, the Keiki population. Unfortunately, we are seeing a slight increase over the last 4 to 5 years, and we really want to really figure that one out and make sure that we're increasing some of our programs that admit Keiki. One of the things that's happened over the last year, and it's just starting to come to fruition during the first and second quarter of 2026, is we did get a decrease and cut funding for several of our domestic violence programs, which impacts the Keiki population significantly. While we can't draw an exact relation to this, I think it's safe to say that the more programs that we have that are focused on families will really help to drive this number back down. Okay, Anna.
Okay, so some other kind of subpopulations to highlight are the Kapuna and youth. And I'll go through this quickly because I know you guys probably want to ask questions. But we've seen a drop in the percentage of the overall count who were 60 years or older after a significant rise over the last few years. We did see a drop in the percentage, but we saw an increase in the number. And so we think that that's due to the fact that we had a lot of adults with missing age data last time in 2024. So I think this does still suggest that we have, a large Kapuna population within our homeless population. So it's at around 19%. And it's a little bit higher on in the sheltered population. So a larger percentage of the sheltered population are Kapuna compared to the unsheltered. So something to highlight for unaccompanied youth. So these are youth ages 18 to 24 who aren't in a household with anybody older than 24. And we've seen that kind of hold steady over the years at around 3% of the overall PIP population. But what we've seen in the past is that unaccompanied youth, they were more likely to be unsheltered than sheltered. Well, this year we saw that trend reverse. So that's good news. So what we see here is that the percentage of the unsheltered population who are unaccompanied youth dropped from 3% to 1%, whereas the percent of the sheltered population that were unaccompanied youth went up. So that's good news. Next slide. A couple of things we wanted to point out. One of the things that we have been kind of watching over the past 5 years or so is the increase in people that with some sort of disabling condition. And this is important to track because having a disabling condition is one of kind of the qualifiers for being eligible for some permanent supportive housing programs. And also, we know that this means that these folks have different types of needs, right? Beyond just financial assistance. So unfortunately, we see that the number and percentage of the overall population that has any one or more disabling conditions has risen. And we've seen this really rise among the unsheltered population. So 70% of the unsheltered population had at least one disabling condition. So that's quite a bit. We also saw a similar trend for individuals who are chronically homeless, which makes sense because chronic homelessness status relies on having one or more disabling conditions and also being homeless for more than a year or more than 3 times that add up to more than a year in the past 3 years. Did I get that right?
Yep.
So we see an increase in that as well. And we see it across the board in the sheltered and unsheltered, but the increases are more kind of significant in the unsheltered population.
And I think I'll just add to this one, it is incredibly hard for a lot of our shelters to take in folks who have serious medical or physical disabling conditions. Making sure that access is available is very tough. And that's the same in the rental market, finding units that are ADA compliant is very difficult. So again, not to draw too much of a conclusion, but some programs are not able to take in people. And so it's been great to see some new programs such as the Kauhale Respites that are looking at folks who have physical and medical disabilities. And hopefully they're coming out of the hospital or they're out on the streets. And really trying to take care of those folks and either get them healthier or be able to locate programs and housing that will support them into the future.
Great. So I won't go through all of these, and this is all in the report if you want to take a look. I'll just point out a couple of things. So we see, an increase for the unsheltered, specifically in mental illness, physical developmental disabilities, and substance use disorder. For basically all of these conditions, such except HIV/AIDS, we see an increase among the unsheltered population. So about 46% of the unsheltered population they self-reported that they had a mental illness, a severe mental illness. 42% reported that they had some sort of physical or developmental disability. And 37% reported that they had a substance use disorder. So, like Laura said, these conditions make it complicated for finding appropriate care and services for these folks. So it will be interesting to see if the trend changes with the introduction of the new respite programs and the new Medicaid respite benefits. So it will be, I'm cautiously optimistic that we will see some changes in these numbers next year.
All right, this is some more information on domestic violence. We see a slight dip in this this year, and we hope to go back to being able to provide as much shelter for DV survivors and their families as possible. And go through this. This is just some of the characteristics of those experiencing domestic violence. And then we just really wanted to get into this. This is a sub report within our full report. And so while the point in time count is a snapshot, the HMIS inflow outflow is really looking at what is happening throughout the year. And so as you can see, in 2024, we had 12,441 individuals unduplicated receiving some type of homeless, houseless service throughout that prior year in 2024. This year it has gone up, which in some ways is really great because that means that more folks are getting services out in the community, which is what we would like to see. But we would like that to also match and help people move out of the system. So this is information that our providers across Oahu input into our homeless management information system. This is our large database that allows us to look at trends on a regular basis, monthly and annually. And most of these dashboards are available on our website on a monthly basis. So this is a very important portion because this is the other look at homelessness. So we have a snapshot in the point in time, and then we have the inflow outflow as a secondary source of information. And then this is looking at, we see the same types of trends within our database that we saw in our surveys of those during the point in time count. And then here, we messed up that slide a little bit. Sorry about that. These are some of the demographics that we're looking at. So the majority of the folks that are receiving services throughout the year are age 25 to 59. We are seeing an increase in the number of seniors who are impacted by homelessness. And so we're hoping that we can push that one down. As most of you, I'm sure, are aware, we do have an aging population in general, and we're starting to see folks experience homelessness for the first time later in their life. And often they do not have the resources or the knowledge to be able to look for services and resources on their own. And we are currently working, this is one of our priority groups that we are working on to try and get better services out to them. And more importantly than anything, for those seniors is getting prevention out there for them so that they never become homeless to begin with. And then these are some of the characteristics of what we're finding with folks within our database. And as you can see, it's really important for us to track folks throughout the years and how long they've been in our system. So as you can see, we've had 34% of those who we tracked within our HMIS system have been in previous counts. And then we're looking also at the chronically homeless, which is a formula that gets worked out. It's over the course of a couple of years and how many times you've become homeless during that time. So that chronic homelessness is where we're looking at folks who have been affected the most and are more likely to be more vulnerable because they've been out there for a longer amount of time. And then I think just in conclusion, we'd like to say that we are excited to see the shift from unsheltered to sheltered. We want to emphasize that because at the shelters, there is better access to services on a daily basis. So we're really encouraged by that. We continue to be encouraged by the fact that our veteran homelessness has decreased significantly. And that's really, really important for us because they have served for us in times of war and in times of peace. We want to make sure they are taken care of. You know, again, our other key finding was about Kupuna and really trying to prevent them from experiencing homelessness to begin with, and focusing on how we can make those accomplishments. And so what are our next steps? Well, we'll continue with additional subpopulation reports. Some of the ones that we're planning on doing is a deeper dive into Native Hawaiian and their experiences of homelessness and houselessness. We also have a new partnership with the Department of Education to look into homelessness and houselessness and how it affects folks who have young children in school, and then our Kupuna report. We're also going to be able to look at the national trends and see where we are measuring up across the country, because we can always find new ways of addressing houselessness and homelessness from what other people in other states and across the world are doing. And we're also looking, we are expecting to see some significant cuts in some of our federal funding. So being better prepared and using all of these data points to really braid our funding as much as possible. And the bottom line is to support our providers so that they can have the services and the resources they need to help those experiencing homelessness. And with that, we will open it up. Just wanted to again thank the HMIS team and the Partners in Care team for all their work on this. It doesn't answer everything, but it gives us a platform of where we can start from, starting today and looking ahead and really focusing on what are the programs that have proven to be successful, what are the programs that need a little bit more work, and how can we make that all come to fruition during a time when we are looking at the possibility of cuts to funding. So with that, we will open it up for questions. If anybody has any questions, as soon as this recording is available, we will put this onto our website, which is partnersInCareOahu.org. Please go there, ask us questions, and we'll open it up and see if there's any last comments from Tanya or Anna. Okay. All right, let's throw it over to Ben. Go ahead and unmute yourself.
Hi, thanks. Ben Ingram from Civil Beat. Can you talk a little bit more about the age data that seems to be missing from 2024? Just like what the reason is for that?
That's probably a question for me. So in 2024, we had a lot of observations, and I can't remember the reason why. I don't know if there was like a something going on with the survey tool, but it didn't capture the estimated age groups for the observed adults. So it was, I mean, we still got most age data, but it was just a larger number of missing than there was this year.
Okay, was it like a glitch or something then?
you could call it a glitch. A part of it is, you know, when you scroll through all the years, a lot of folks were transposing some of those numbers. So we had to discount some of those age questions because it was, you know, if a person was born in you know, 1856, that's not going to be an accurate birth date. And so during the cleaning of our data, we're able to go through quite a bit of it and correct the ages because folks are in our system. But if they were just observations and the dates didn't kind of calculate correctly, we had to remove them from that data point.
Another reason too was that the survey tool for observations in 2024 only had 3 age categories: under 18, 18 to 24, 25 and up. And so this year it was at a more granular level. So we were able to get that estimate.
Thank you.
Raquel?
I think it was the first year we were able to do that actually. So
yeah. Raquel, you can come off mute.
Hi, can you hear me?
Yep.
Okay, I was going to say, can you guys talk a little bit more about, it was on the unsheltered characteristics slide, but can you talk a little bit more about how many unhoused people that took that survey? I know it said only like 8% were employed, but do you guys have any more, do you guys captured any more data with how many people were experiencing homelessness and were employed?
So I'll just say simply that, you know, it was either a choice to answer it or not answer it, and any other details. But no, if they said they worked, we did do training on all of the surveyors, so they should be asking all the same questions. So if those questions weren't answered, we weren't able to collect it. But Anna, you have another thought?
no, I was just clarifying the question. Are you asking how many people were asked the question? Or are you asking if we have any additional data?
Just any more additional data that was captured?
Yeah, so actually, if you look in the report, that was just, I think, released while we were talking. There's data tables in the appendices that list all of the answers to employment-related questions. There was a question related to, are you employed? And if so, part-time, full-time, or self-employed. And if you're not employed, how long have you been unemployed? Less than a year, more than a year, or are you unable? So you can see how many people selected unable to work, and it was quite a bit. So yes, that data is in the appendices.
Okay, so we're going to go Connie, Ashley, and then Ben. So Connie?
Thanks. First of all, I just wanted to thank you guys for such an awesome report, you know, with so much data that we can really take a look, a deeper dive with so many different populations. I'm particularly interested in the inflow-outflow report and whether those intakes were unduplicated. Do they represent unduplicated people, or is it, you know, just intakes in general?
So we have the unduplicated count in general, the 14,000, and then enrollments were duplicated. So if a person was in more than one program or received more than one service, that would be duplicated count. Anna, anything? Yeah.
No,
And
I
then
didn't work on that section, so I don't know.
And then the other question I had was in the Native Hawaiian and other Pacific Islanders, is that where the COFA group falls to, COFA migrants?
Yes.
And, you know, when you talked about moving forward, you had deeper dives into that population. Will you guys separate out some of those subpopulations too?
Yes.
Awesome.
We definitely do. We do a Native Hawaiian report, so it's only those who state that they have some Native Hawaiian. We've never done a Micronesian specific subgroup, so that might be something we would look into. I do know it's a significant number, so it might be worth worth our time and efforts. When we do the sub reports as well, we invite people who have some knowledge in that general area to join on figuring out those sub reports, because we can pull in more stuff into those sub reports. So it wouldn't just be the information we collect on the point in time count and the inflow outflow. It might also include some other stuff. So anyone who is interested in helping us with a sub report, please let us know.
Thank you.
Okay, and then Ashley.
Hi, Ashley with KFF Health News. I had a question about the domestic violence slide. Is the assumption that the reason that there are less people who have experienced domestic violence in shelters because of the cuts to domestic violence programs, or is it that there's less domestic violence being experienced?
No, that's a great question, and that's often a question across the board for a lot of different things. If there's less services, there's often less people that are asking for them. So one of the big things that we don't collect is all the people that are denied that service because of the lack of resources. And so we cannot say how many folks are asking for domestic violence resources. But we can report on what is available and what they, how many folks are accessing those. So that is a big issue. You don't know what's not collected. I mean, we don't know the answer to what's not collected. But I would make some assumptions around the lack of services and the cuts. You know, we focused a lot on domestic violence survivors over the last couple of years for the point in time count, because that was a high priority from our federal partners at HUD. And then, like I said earlier, over the last year, we got several of our domestic violence programs cut. The federal funding cut. So it was a priority, and then they cut it. So we had a sharp increase in the amount of services available over the last couple of years, and we're now starting to see some of those programs either shut down or get other types of funding to support their programs.
Thank you.
Yeah, and Ben?
Can you talk a little bit about the bed utilization going down, and then having the little partial recovery? Like, is that a COVID-driven thing, do you think, or is it more complicated than that?
Go ahead, Anna. I'll throw that to you. Oh, no.
I have no idea. I didn't
Yeah.
work on that section. Sorry.
Sorry. Actually, what we do have that we will be releasing shortly is a utilization report that specifically is looking at all of the services, and it's over the course. It's not going to be including 2026, but I believe it goes 2019 to 2024. So we'll be able to share and look at those statistics and the utilization. Some of the things regarding, you know, if beds are not being used, it's not just that there might not be somebody who's interested in going into shelters. It can also be because of a lack of supportive staff in that facility. So that does happen. I'm not going to say quite a bit. I do know it happens at times. And it's if a shelter does not have enough people to on staff at that time, it's really hard for them to fill some of those beds out of safety and responsibility. But we'll be diving a little bit deeper into those questions with that utilization report.
Thank
Yeah,
you.
and the utilization report will look at it over the course of the entire year, which I think gives a better picture than just a 1-day snapshot.
Yeah. Any other questions from anyone? All right, I want to thank everyone. Tanya, would you like to close us out?
Just want to say thank you to everyone for being here and for supporting our work ahead.
Thank you all. And if you have any questions, please reach out to us at Partners in Care and go to our website. We have a lot of information there, and help us figure out what other questions we need to answer so that we can solve this issue of homelessness and houselessness and make sure that all of our community members are taken care of. Thank you.